In this episode of the Nurse Practitioner Podcast, Christina Stapke discusses burnout. Thanks for taking the time to chat with us today, Christina.
Yeah, thanks so much for having me.
Well, first, can you please tell us a little bit about you and your practice?
Yeah, absolutely. And again, really grateful to be here. Thanks so much for having me. I'm really excited to chat about this topic today. My name is Christina Stapke. I'm an integrative and functional dietitian and own a clinic called Sea and Spruce Nutrition. We are a virtual nutrition counseling practice and can see clients all over the US and have locations in San Diego, California, and Seattle, Washington. And a little bit about my background, I've been in the nutrition field for a little over 10 years. And before starting my practice, I worked in both inpatient and outpatient worlds, was in the inpatient setting and ICUs and GI surgery, oncology, med surg, all of the things as a float dietitian. And during that time, I worked really closely with nurse practitioners, nurses, all kinds of clinicians, but especially had a close connection with nurse practitioners and have friends, referral partners, but also clients now as nurse practitioners. And essentially what we help people do in our practice is just help them feel better and activate their body's innate ability to heal with nutrition. And I do have a strong focus on and passion for also helping other clinicians, especially nurse practitioners, because at the end of the day, we have such a high risk of burnout, especially if you're in the clinical setting. And ultimately, if we're not taking care of each other and we're not taking care of our bodies, it's really difficult to, one, actually live the life that we want and live out of that survival mode, but also to be able to take care of our patients and have a healthy system. So that's why I'm really excited to talk about this topic today.
That's excellent to hear. Now, what got you into this, and what made you decide to focus on integrative and functional nutrition?
Yeah, so initially I got into this field dealing with a lot of personal health issues, digestive, autoimmune, fatigue, burnout was definitely a part of my history. And the conventional approaches I was using just wasn't really helping. I was feeling terrible and I didn't really know what to pursue. And so I started thinking about nutrition and how I could actually feel better with that approach. And so I decided to become a dietitian and chose that path. And along the way was introduced to this other realm of integrative and functional nutrition, which I'll go into a little bit more in depth during this episode. But I really understood it as, and a light bulb went off in my head when I learned about it, like, oh, this is personalized nutrition. This is understanding nutritional underlying causes. And I really began to heal using a lot of these kinds of approaches, getting supported by practitioners, using the most up-to-date evidence, and then also getting a ton of training myself. So kind of during that process, I had become a dietitian at that point, and I was working in the hospital in the clinic setting I mentioned. And this was during COVID, and very quickly, and I know a lot of people listening to this can probably relate, became very burnt out. Just being in that really, really high stress environment. And, it was just a combination of course, the nature of being in a pandemic, but it was also, the work environment I was in, but also I didn't really have a setting to help people in a really significant way as I had began to heal on my own with these integrative and functional approaches. So I decided to open my practice, and that was actually pre-COVID and virtual, which was very convenient. And I had a lot of renewed energy and excitement from just being in that clinical setting, but now being in a setting where I could really help people in a deep way, really understand what their body needed and starting to feel better. But also that shift in environment was one thing. What I'm going to be talking about today is a lot of the practical nutrition and lifestyle strategies I was putting into place to help me heal from burnout really helped give me that extra boost of energy and motivation to open up my practice in the first place. So I'll be talking about a lot of those strategies today. And I'll go into integrative and functional a bit more, but basically to summarize it is how it's different and what it is it's using the most conclusive evidence that we know of as far as nutrition goes, but it also it's considering the whole person, personalizing protocols versus having kind of more of a generalized protocol. So that's a little bit about what got me into this and what made me decide to focus on this area.
Thanks for sharing a bit of your background with us. Through your experience seeing clients over the years, what have you noticed are the biggest struggles nurse practitioners, other healthcare practitioners, and patients alike experience related to burnout?
Yeah, so I'll definitely go into the really common struggles that we see both NPs but other clinicians face. And before going into that, I just kind of want to define burnout. I mean, I know for those of you listening, you're very familiar, but as far as how it's established in the literature and kind of the characteristics of burnout, we think of one, feelings of energy depletion or exhaustion, two, cynicism, and number three is reduced professional efficacy. So where we see our role as an integrative and functional dietitians and nutritionists in the practice is really especially focusing on the energy depletion and exhaustion piece, but also so many other health conditions that stem from that versus cynicism, reduced professional efficacy. That being said, we do see people just shift as far as what they're able to tolerate in their work environment. And I just kind of want to clarify that piece. And then again, before going into what we see as far as health issues go or symptoms and struggles, is really the biology of burnout that we're learning from the literature that's available right now is really we're seeing a consistent activation of that sympathetic nervous system, right? That chronic stress response, that chronic fight, flight, freeze response. We're also seeing dysfunction in the sympathetic and adrenal axis. And then lastly, we're seeing alterations in cortisol levels. So if we're taking all of that into account, that is tending to what leads to all these different struggles from different symptoms like changes in the brain fog, lower cognitive function. I might hear people all the time saying, like, my memory isn't as good. I just don't feel like my brain is as sharp as it was. To systemic inflammation. So this especially can manifest as musculoskeletal disorders in women, especially immune suppression or more susceptibility to infection, chronic fatigue, which is a very, very common one. Definitely something I experienced. Digestive issues, another very common one is metabolic syndrome. I'll talk about that in a minute, but very common things that we see all the time is weight gain, elevated blood sugar, prediabetes, insulin resistance, all the things that come with metabolic syndrome, heart disease, and thankfully we don't see this in practice, but in the literature, it's associated with premature death, which is, this is a big deal. And we know this is at this point a public health crisis, just dealing with the amount of clinicians that are burnt out. And so those are what is in the literature, but also what we see. But as far as like day to day, personally, what we hear people are most frustrated by is at the end of your 10, 12-hour shift, you've had a really long day, you're mentally and physically exhausted, you get home, the last thing you want to do is go cook yourself a healthy meal, exercise, like reduce your device exposure, blue light exposure, get to bed at a reasonable hour, like all of the things that, especially if you're in an outpatient environment, you're probably telling people to do. It's so hard to gather the motivation or energy to do those kinds of things when you are burnt out and you're working really long hours. So what ends up happening, and we see this in the literature as well, is that it does become this vicious cycle of, okay, you're exhausted, but then it's leading to lower levels of self-care, not prioritizing nutrition, not being able to, again, exercise and do these other healthy habits that we know are important for preventing the worsening of burnout. So that, is one piece I see all the time. People just don't know where to start and they don't know how to shift out of that cycle. So just to kind of discuss what I want to focus on today, there's the integrative and functional approach that I think is really commonly overlooked when it comes to burnout. But it goes without saying that, especially to this community, that burnout is a systemic issue. And this is, something that needs to be addressed on a systemic macro level in hospital systems to be able to take better care of our clinicians and ultimately make clinical work environments more sustainable and healthier to work in. Okay, so that being said, when we're addressing burnout, we want to ask from a nutrition standpoint, how can we begin to rebalance the body systems and actually allow it to recalibrate that have been impacted by burnout, those systems I was mentioning earlier, with essentially three things. First thing is personalized nutrition, and that's with, easy food recommendations and goals and personalized third-party tested high-quality supplements. Number two is healthy lifestyle habits like sleep, stress reduction, and movement. And then lastly, setting boundaries around work to be able to heal from burnout or even prevent burnout. And I do see this in my scope of practice, even as a dietitian, because ultimately, if I'm working with someone who is not setting boundaries and is highly stressed consistently, that's actually going to increase their nutrient needs. So that's a summary of some things we're going to be talking about today, but also the biggest struggles we see people face, especially clinicians and nurse practitioners.
That's some valuable information we hope our listeners will find helpful, and we're sure many have experienced themselves. What are the biggest misconceptions regarding burnout?
So the first misconception I hear is that you absolutely always need to leave the work environment or need to do something really drastic to heal from burnout, which for a lot of people isn't possible or realistic. I once heard some advice about when I was burnt out, like, okay, just take a 6-month sabbatical. Well, that's not always possible for all of us, right? So that doesn't need to be the case. It's kind of two parts of the same misconception. So one, you don't have to leave your work environment, or you do have to leave your work environment as a misconception. And number two is nutrition doesn't play a role, or nutrition doesn't make a difference in burnout. And that's not true. We actually see, well, of course, in practice, I'm going to be talking about that today, but we can also see in the literature, for example, the Mediterranean diet and mindful eating. These are strategies that have been studied to actually help reduce the risk of burnout, because we're replenishing someone's nutrient needs from the chronic stress. We're also helping, balance things like blood sugar and several different things. And I know all of you are listening. I'm sure you're aware of the Mediterranean diet, but just a little bit of a recap. Very whole foods focused, focuses on really healthy fats, omega-3s, fatty fish, but also things like nuts and seeds, avocados, really lovely healthy oils, things like fish and poultry, as it really focuses for proteins as well as some plant proteins. So that's a little bit of a recap, but we see that this can actually make a really big difference in reducing the risk. So the caveat there is, okay, so what if you're burnt out? How easy are these changes actually going to be for you to make a complete different shift to doing this kind of approach? And I will say too, as far as mindful eating goes, something I see all the time is emotional eating, because people are so stressed and food is a really easy way to cope. And so, if that feels like you're definitely not alone with that, I see that all the time in practice for clinicians and, other patients alike. So again, these changes can be really difficult, especially if you don't have that guidance. But I will say, just to kind of make the point of, you don't have to leave your environment all the time. Of course, there's going to be exceptions. If something's a really unhealthy, toxic work environment, then there's going to be some cases you do have to leave that setting. For the most part, again, it's really about increasing the body's stress resilience. So I'm going to tell you all a story just about one of our nurse practitioner clients. I saw her. So this was actually 2021. So she had been, dealing with a year of COVID, and I believe she was actually in an outpatient setting, again, as a nurse practitioner. So her job was already really stressful as it was. COVID definitely increased her stress significantly, her anxiety significantly. And again, I know you all can appreciate that as well. She was dealing with things like weight gain. She had worsening digestive issues. She wasn't sleeping well. She was dealing with hormonal issues as well. And she was just having a really hard time understanding, like I was mentioning earlier, just how to shift out of that cycle of not implementing healthy habits when she was recommending these things to her patients. She wanted to do these things herself. So essentially what we started to do, and I'll give you some more examples throughout, was just set some really, really basic goals together around how can we do this, one, in a really feasible way, but also one that's personalized to the health condition she was dealing with, her blood work, her health history, and the core imbalances that we suspected were at play. So that's essentially what we looked at first. And we worked on, okay, how can we just really easily increase the nutrient richness of her meals? How can we just add little tweaks here and there? Felt really doable. Worked on things like hydration, worked on her sleep habits, added in some supplemental support when it was appropriate to help with her sleep and her nourish, basically repleting a lot of her nutrients she was likely very low in over the years, I would say year plus definitely, of chronic stress. Working on some really easy goals for movement. So working on kind of all those things in addition to stress reduction. And I mean, within like 4 months or so, she was at a place where her work environment didn't change, but she felt like she could handle it better. Of course, the stress was still there, but she didn't feel so exhausted. She felt like, her body was rebalancing. She had a good system in place for implementing a lot of strategies that she recommends to people all the time. So that's just, one example of how, you don't have to leave your work environment all the time to begin to heal from burnout and to begin to feel a little bit better.
That's great information to know that we could easily overlook. Why is it important to consider integrative and functional nutrition versus conventional approaches when addressing burnout?
So I'm first going to just differentiate between conventional nutrition or conventional approaches and integrative, especially when we're thinking of burnout. So essentially, if we're thinking of conventional nutrition, this is typically characterized as very general meal plans, very, very general dietary guidelines for, the population as a whole. It tends to demonize specific food groups, mainly focus on, a disease or illness. So, for example, you have a health condition and then you have a very cookie cutter meal plan, very solely focused on food, but not, again, in more of a generalized way. So not really considering anything outside of food. And the shortfalls of this approach is, especially for someone who is showing symptoms of burnout or even some other health conditions that are coming along with burnout, is very likely not going to be able to get what their body needs with general recommendations that are made for everyone. So, especially when it comes to nutrient needs, digestive health, and a variety of other things. So that's the conventional approach and the shortfalls. Another approach is using integrative and functional nutrition. Okay, so what does this actually mean? So how it's different is we're looking at and actually recommending foods and supplements to someone's biology. So actually basing that not only health history, symptoms, but blood work, evidence-based specialty testing when needed to understand what is specifically, plan made for them. We're also focusing on a healthy relationship with food versus kind of putting someone on a diet. We know that's not sustainable long-term. Looking at nutritional underlying causes to understand what imbalances are at play, especially as a result of burnout. We're also focusing on habits that we know are really important, like sleep, stress, and movement, but also considering other factors to tailor recommendations, like genomics, toxin exposure, digestive imbalances, and many others. So, for example, using this integrative and functional approach, if we're considering two nutrients, just as an example, that are very, very important for adrenal function. So again, if we're going back to the biology of burnout, that chronic sympathetic state, that dysfunction in the sympathetic adrenal axis. Oftentimes what comes along with that is depletion of things like niacin or vitamin B3 and pantothenic acid or vitamin B5. These are things that we test people for all the time through, again, evidence-based accurate testing to look at their micronutrients. And I would say almost always people that are chronically stressed need more support in at least one of these two nutrients. And unfortunately, we cannot get a therapeutic amount of these nutrients for someone that's been chronically stressed just from food, or even a basic multivitamin you can get at a drugstore. So that's just one example of how we really need to kind of take the whole person into account and how integrative and functional can be useful. Outside of that, we can also look into things like adrenal health testing, looking at cortisol levels, looking at DHEA, looking at digestive health markers, just to understand, again, what kind of imbalances have come up, especially after the burnout process or when it's well underway, but also how can we use those tools to help prevent things that are starting to shift if someone is in a really stressed out environment and their body is already starting to see the impact of that. So that's a little bit about the differences of conventional and integrative and functional nutrition and how those can be useful for burnout.
Thanks for breaking down the differences between those two nutritional options. What are the biggest mistakes people make when trying to address their burnout?
I would say one of the biggest mistakes I see, because these are people that I end up working with, are people that don't address the burnout sooner, and they let it go on for so long to the point where they have to make changes. And, it's resulting in health issues, all the things that I was mentioning, exhaustion, sleep issues, digestive issues, usually comes along with some elements of metabolic syndrome or metabolic dysfunction. And, so that's probably one of the biggest mistakes is people don't get that support sooner and they just, are in survival mode. And I don't blame you. I've been there before too. So, but that's probably one of the biggest. And another thing that I see too is especially if people are trying to get support with this sooner. So let's say, they do start to see some side effects of chronic stress. Maybe, their metabolism is impacted. Maybe they are seeing some issues with sleep or brain fog, digestive issues, and they do try to do it on their own. And they try to kind of do a quote unquote diet that's not personalized to them and typically really unrealistic. And so typically, someone will start that and then it'll get really difficult and then they'll stop. And then it just is kind of the cycle of not really having sustainable lifestyle change. So again, those are probably the two biggest mistakes I see is first, people don't get support soon enough. And then number two, they try to do things on their own or try to follow kind of a cookie cutter diet.
We hope NPs and patients listening alike take this advice. What can be done to help prevent and or recover from burnout from an integrative and functional nutrition perspective?
Yeah, so when we're thinking of both prevention and recovery, those are two different things, right? So I'm going to share some different tools that we use if someone is kind of more in the preventative state or if someone is more in the recovery state. So what we use in our practice is our Vibrant Health Protocol. And essentially what it does is it helps us address a lot of core areas that can be out of balance when it comes to burnout, which I'll talk about in a minute. So, but first I'm going to talk about prevention. So let's say, you're in an environment, you are under stress. And let's be honest, especially as clinicians, like there's always going to be an element of stress. It's just, they're varying degrees, right? So if you're in that place of prevention, you want to start to prevent health issues. Maybe you see yourself slipping a little bit with, implementing some healthy habits, you want to be doing. Maybe you're, telling your patients to do these things yourself. We really always want to start with some simple goals around foundations. But the big question we're asking is, how can we increase the body's resilience to stress? And of course, we'll talk about boundaries in a second because there's only so much we can do to increase our resilience if the work environment is not suitable. But how do we increase your body's resilience? So to start, we really want to focus on nutrition foundation. So again, how can we make it super simple to prepare a couple easy meals that are not very time consuming, that actually taste good during a time where you have some more energy, not when you get home, after a 10-hour shift. We want to set you up for success. We want to put some systems in place where you have some things ready to go. Coming up with a game plan for groceries and, eating out and kind of creating some structure and setting some easy goals around all of that. We also want to work on lifestyle foundations. So habits like sleep, stress reducers, easy movement. And I should say all of these things come with time, right? This is not something we set a bunch of goals around at the very beginning. These are incremental goals. Work boundaries are definitely something that we work with our clients on, especially if we're in that state of prevention to, again, just make your work life more sustainable, however that's possible. What I like to look at a lot is micronutrient analysis. So this is an evidence-based and an accurate way of testing someone's micronutrients. We oftentimes look at organic acids to understand what someone needs to support their adrenal glands, but also to support their neurotransmitter balance, but also things like digestive health as well. So I'm just going to give one example. We were working with this one client. She was actually training to be a nurse practitioner, and she was in a clinical setting for a while and came into us pretty much getting close to that burnout phase where she was absolutely exhausted. She was dealing with a lot of digestive issues. She just didn't feel like she could think very well. She was dealing with a lot of brain fog. And essentially what we did, we started to work through that Vibrant Health Protocol, worked on her foundations, easy goals like I was just mentioning. How can we just get her more nutrients in her food? We did do some micronutrient testing to understand what her body needed. We came up with really strategic and targeted foods to add in, easy meal plans for her to follow that actually tasted good, high quality supplements that she needed. And those kinds of interventions paired with assessing her digestive health and putting together a personalized plan based off of that information led to her feeling so much better, just a little bit more in control of her energy, her digestion, being able to be able to tolerate work more and be able to get through her day, not absolutely exhausted. Of course, her work environment was something different, but she just felt like she could go through her day with a bit more resilience. And she actually ended up making a career transition and, was motivated in a lot of other ways. But that's just one example of kind of a process that we would use for prevention. So implementing strategies for adrenal support with lifestyle, but nutrition as well. So that is one example. And then if we're thinking of recovery, it's going to look a little bit different. So like I said, we see a lot of people who have been in this state for a really long time, and they're finally at a point where they're really at a breaking point. They need to make some changes for their health, and they just haven't been able to shift out of that cycle. And so the question here becomes, how can we now help recalibrate the body's stress resilience? So both increase but recalibrate, because things have become so dysfunctional for a long time. So this will also depend on the health issues that develop. And I will even say, for people who are in this state, which again, I've been there, we've worked with a lot of people in this place, it's like the simpler goals, the better. And sometimes it feels basic level or silly level of basic, where it's like, okay, this seems really essential. But no, it's honestly what it takes is also having someone support you and hold you accountable to those changes. And if things come up, then working around that. So while there's a huge element of personalization, we also work on the same core foundations I was just mentioning, with nutrition, hydration, those lifestyle habits. For someone who is in that burnt out place, it typically requires a little bit more investigative work to know how specifically can we begin to rebalance their adrenal health and adrenal function and neurotransmitter balance. So oftentimes we look into more things like cortisol analysis, DHEA. We support with specific nutrients, herbs when needed that are researched. And so those, sometimes that requires a little bit more investigation. I can think of one client I want to share a little bit more about who was more in this, again, recovery place. And initially, we were actually amazing referral partners. I really appreciated her. And she was sending me patients of hers, and she was seeing these people feel better and, get better with this approach. And, she was an amazing practitioner, recommending a lot of the things, that we've been talking about, the lifestyle strategies. And she felt hypocritical because she, this is something that she shared with me. She wanted to really be able to align with and embody the things that she was recommending to her patients, but she just didn't have the capacity to. So at the beginning, we focused on some really core basics of hydration and sleep, increasing nutrient levels through her food, adding a few core supplements, adding some adrenal support that was personalized to her. And through that process, she just felt empowered with that information. She was no longer neglecting herself. She actually was building this positive momentum, and she was beginning to feel better with these small changes. And, she realized that she ultimately could create the life that she wanted for herself, rather than just being this, consistent burnt out practitioner. She could actually go be, the practitioner she wanted to be, that was consistent with what she was recommending to her own patients. So those are a couple examples of how we use our integrative and functional approach, our Vibrant Health Protocol, to specifically help with prevention and recovery. And, these are even things that if you come across people, even patients of yours that are feeling burnt out, setting really feasible goals with them that feel so basic, but really being that supportive person for them, especially if you are in an outpatient setting, can be really helpful just to kind of help them build confidence in implementing change.
Thanks for sharing those insights and story. Finally, can you tell the audience how they can find you?
Yeah, absolutely. So best way to find us is our website, candsprucenutrition.com. C like the ocean, spruce like the tree, nutrition.com. We're also on social media. And for anyone who may be interested in just learning more about how to help with their own burnout, if you are dealing with health issues, you're just curious about what the process is like, we do offer a free consultation. Again, if you just want to learn more about the process.
Thanks again for your time today, Christina.
Thanks so much for having me.
For more great content from the Nurse Practitioner, be sure to visit us online at tnpj.com for the latest NCPD articles, columns, and much more. Please leave us a 5-star review on iTunes and Spotify, as it helps with the podcast's visibility and helps us to keep bringing you this great content. Also, don't forget to follow us on Facebook, Instagram, and LinkedIn at TheNursePractitionerJournal, and on Twitter at TNPJ_journal. Thanks for listening. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed on this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Please note that the hosts of the Nurse Practitioner Podcast are not clinicians. However, we created the Nurse Practitioner Podcast to bring you relevant clinical information by NPs for NPs. Thanks again for listening.